Development Goal, we have chosen clean water and sanitation.
The United Nations Sustainable Development Goals act as a universal blueprint for achieving a sustainable future. Among 17 adopted goals in the 2030 Agenda are targets surrounding clean water and sanitation, one of which encompasses achieving access to adequate and equitable sanitation and hygiene, ending open defecation and paying special attention to the needs of women and girls and those in vulnerable situations. Access to water, sanitation and hygiene is a human right. However, demand for these services has outpaced population growth. Those marginalised by location, socioeconomic status and gender are most prominently affected, with 1.6 billion people lacking safely managed drinking water, 2.8 billion lacking safely managed sanitation, 1.9 billion lacking basic hand hygiene, more than 673 million still practising open defecation, and at least 500 million women and girls lacking adequate facilities for menstrual hygiene. These statistics evidence and explain a colourful history of disease due to the spread of pathogens and infections, for example, the COVID-19 pandemic, which highlights the global importance of the clean water and sanitation goal in the prevention and containment of preventable disease.
From 2015 to 2020, the rate of individuals over the world using appropriate sanitation services increased from 47% to 54%. If rates like this continue into the future, it is expected that the sanitation rates will reach 67% by 2030. Yet there are still 2.8 million individuals without this access. By 2030, it is also expected that the practice of open defecation will decrease by 33%, from 739 million people to 494 million. It is important that hand hygiene practices are implemented into communities, especially to control COVID-19 as well as many other infectious diseases. Despite the essential need for proper hand hygiene, 1 in 4 individuals do not have access to adequate hand washing practices, including soap and water in their own homes. The coverage of hand washing practices has increased from 67% to 71% from 2015 to 2020. Despite these improvements over the past 5 years, the progress needs to increase exponentially, as billions of people will still not have access to the important practices and services by 2030. This graph shows the rates of open defecation, basic sanitation, and safely managed sanitation in 2015 to 2020, as well as the predicted results by 2025 to 2030.
Appropriate measures have been implemented to ensure the United Nations reach the goal of SDG 6. These measures include supporting policy and decision makers by monitoring water and sanitation related issues. A collection of this data by not only the government but also communication from the general public allows for identification of gaps in data. This data is a collection of varying factors such as environmental, climatic, social and economic information. This information is compiled into infographics to be interpreted by specific individuals to allow for thorough understanding of the progression of this goal. Global indicators to identify the status of varying water and sanitation issues have been created in order to track the progress at global, regional and national levels. This has allowed for awareness to aid in an efficient resolution. Adequate financing and political will has also assisted the UN in the progression of reaching this goal and will continue to do so.
Poor water quality and lack of sanitation is a leading cause of death and illness in children and adults, and diminishes the positive effects of food and nutrition programs. So investments in water and sanitation significantly reduces healthcare costs. 2030 projections fall short of 100% access to clean water and 0% open defecation. To improve this trajectory, research is needed on more effective ways to provide sufficient and equitable access to clean water, including installation of wells, bores, tanks, taps and sewage treatment. Knowledge on how to best provide education and training on how to maintain these facilities is crucial for sustainability into the future. This can involve engineers, tradespeople and educators. Thanks to increased scientific understanding and powered by the COVID-19 pandemic, hand washing practices have improved, and this is a large factor in removing pathogens from hands and decreasing the spread of harmful diseases and other illnesses. Providing appropriate knowledge and resources surrounding menstrual hygiene will also increase school attendance and improve overall well-being for girls and improve equality for women. There is a need to build the capacity of local governments to manage the quality of drinking water and sanitation facilities. Perhaps increasing awareness of the plight of citizens in undeveloped nations within more developed countries is the way to go. Raising awareness and encouraging those more fortunate to pitch in and help. University undergraduates in relevant fields could be required to complete a hands-on